All right, let's get right into it. Today, we're investigating a condition that can make something as simple as taking a breath a really painful experience. It's called pleurisy. We're going to find out what's really going on when a breath becomes a burden. So just imagine this for a second. You go to take a nice, deep, satisfying breath, but instead of relief, bam, you get this sudden stabbing pain in your chest. It's a pretty frightening experience, right? Well, that feeling is the central clue in the medical mystery we're unraveling today. To really understand what's happening, we first need to go straight to the source. So let's investigate the scene of the crime, if you will, and explore the anatomy of this pain. The culprit here is a condition called pleurisy, or as it's sometimes known, pleuritis. And what it is an inflammation of the pleurae. These are two incredibly thin, delicate membranes that basically surround your lungs and also line the inside of your chest cavity. Okay, now this is where it gets really interesting. Normally, there's a tiny bit of fluid between these membranes that allows them to just glide over each other, totally smooth, like two pieces of silk. But with pleurisy, that inflammation makes them rough and sticky, so they start to grind and catch on each other. It's more like two pieces of sandpaper. You can just imagine how that feels. And that right there is the source of the pain. Every single time you try to inhale, your lungs expand, and those inflamed, gritty membranes are stretched and pulled against each other. That catch is the very thing that sends that sharp, unmistakable signal of pain right to your brain. So we know what pleurisy is, but the big question is, why does it happen? In this next section, we'll take a look at the causes and the potential complications to really understand the bigger picture here. You know, pleurisy is rarely a standalone problem. It's more like an alarm bell, a signal that something else is going on. The list of suspects is pretty wide. You've got infectious causes like pneumonia or TB, which are some of the most common culprits. But then there are non-infectious causes, things ranging from physical trauma to the chest, all the way to more systemic issues like autoimmune disorders or even pancreatitis. It really does show you just how interconnected our bodies are. Besides that main symptom of pain, doctors are on the lookout for other clues. Since it's often linked to an infection, fever and chills are really common. Patients also tend to take these rapid, shallow breaths because they're subconsciously trying to avoid the pain of a deep breath. And of course, any sudden movement like a cough or a sneeze can be absolutely excruciating. And in blood tests, you'll often see an elevated white blood cell count, which is your body's clear sign that it's fighting something off. Now, if it's left unchecked, things can definitely escalate. The body's response to all that inflammation is to produce more fluid to try and lubricate the area. But you can get too much of a good thing. That excess fluid leads to something called a pleural effusion, which essentially starts to flood the space around the lung. This pressure, combined with that painful, shallow breathing, can actually keep the lung from fully expanding, and that can lead to a partial collapse known as atelectasis. With all of these clues on the table, how do doctors actually put the pieces together to make a definitive diagnosis? In Section 3, we're cracking the case. Okay, so this is one of the most classic pieces of evidence, a clue that a doctor can actually hear. It's a process called auscultation, which is just a fancy word for listening to the body's internal sounds. With a stethoscope pressed to the chest, they're listening for something very specific, a pleural friction rub. It's the literal sound of those sandpaper-like membranes grinding against each other, a really distinct, leathery sound that's a total dead giveaway. The investigation is always thorough. It starts with listening for that friction rub. Then, imaging, like X-rays or CT scans, can help them see any fluid buildup or other underlying causes. Blood work can confirm signs of an infection. And finally, lung function tests give them crucial data on exactly how a person's breathing is being affected. Let's look a little closer at those lung function tests because the results are really telling. So the forced vital capacity, or FVC, that's the total amount of air you can exhale, it's reduced. And why? Well, it's pretty simple. It hurts too much to take a full, deep breath. But the FEV1, which is the amount of air you can force out in 1 second, is often normal. Now that is a key piece of evidence. It tells doctors the airways aren't blocked. The problem is with expanding the lungs. It's what's known as a restrictive disorder. So once the case is cracked and the diagnosis is confirmed, what's next? Let's move to our final section and explore the path to relief. All right, this is probably the most crucial point. You can't just treat the pain. The primary mission is to find and treat whatever underlying condition is causing the inflammation in the first place. Whether it's antibiotics for pneumonia or other treatments for the root cause, that's the real target. Now, while that underlying cause is being treated, managing the pain is absolutely critical. Anti-inflammatory drugs, your NSAIDs, are usually the first line of defense. For more severe pain, opioids might be used. And in some cases, doctors can even perform what's called an intercostal nerve block, injecting an anesthetic to block the pain signals and allow the patient to breathe and cough more effectively. And here's a fascinating and really practical tip. Lying on the side that hurts can actually provide some relief. I know, it seems completely counterintuitive, right? But what it does is it helps limit the movement of that part of the chest wall, basically splinting it and reducing that painful friction. So what's the big takeaway from all of this? It's that a sharp, stabbing pain when you breathe isn't just some random ache you should ignore. It's a very specific, very important signal from your body. It's a call to investigate, not to just push through it. It really makes you think, doesn't it? If a pain like this can point to so many different underlying issues, what other hidden signals might your body be sending you right now?